Hi, everybody. I'm Dr. Weber, and today we're going to talk about categories of disabilities, the WHO. So, in the presentation, we'll talk about the different disability types that we will encounter in adapted physical education. But first, let's go over the table of contents. Let's go back in time to see where we're at. So, we are in lecture number 3, category of disability, the WHO. We've talked about the what and the why. Now we're talking about the who, and then we're going to start getting into the how. So, we'll get into student learning outcomes, objectives and goal setting, assessments and lesson planning, and effective instruction in the future. So let's go ahead and get started. The learning objectives will be to be able to discuss the 3 learning domains related to physical education. You should be able to list the categories of disabilities and describe each one. You should be able to discuss the prevalence and characteristics of a variety of disabilities. You should be able to discuss pointers and suggestions for a variety of disabilities and discuss ways of modifying and adapt activities for a variety of disabilities today. So first you have to understand that there are 3 learning domains. We look at Bloom's taxonomy of learning, which has cognitive, affective, and psychomotor skills. These are the 3 learning domains that teachers have to educate or utilize when students are learning. So we go up basically from remembering and cognition to understanding to applying to analyzing to evaluating to creating. So first we have to remember the rules of the games. First we have to remember the structure of the class. Then we have to understand why it's important. And then we have to actually apply it in our day-to-day lives. We should be able to analyze those practices, evaluate those practices, and create our own practices. So this is all cognition. We know that when it comes to intellectual disabilities, specifically, they're going to be more impaired in this cognitive domain of learning. So it's going to be harder for them to understand and remember, apply and analyze, and specifically evaluate and create. Okay, let's talk about the affective domain of learning. So the affective domain of learning deals with the social emotional skills. So starting with receiving and responding. So how you respond to others, how you receive others, how you value relationships, how you organize and conceptualize things. And it's also characterized by your values and your characteristics. So the affective domain is more of the social domain of can you socialize with positivity? Do you have a positive or negative attitude? Do you have restrictive behaviors that maybe limit this affective domain? So something like autism spectrum disorder, you may have some lower progressions of the affective level of skill. When we look at the psychomotor, this is the one most associated with physical education. So imitation of movement, manipulation of objects, precision like throwing, articulation, and naturalization. Basically being able to do something without effort, basically. So doing something fluidly through movement. And so people with cerebral palsy or orthopedic restrictions are going to have a tough time with the psychomotor domain. They might not have issues with affective and cognitive skills, but they may have issues with psychomotor ability. So depending on the disability, we could have a cognitive disability, an affective disability, or a psychomotor disability. So it's important to note that there's 3 domains of learning and there's 3 different disability types that can be affected. So when it comes to the disability categories at IDEA, remember the Individualized Disability Education Act, they specify what disability categories there are. And we're going to go over those disability categories. We're going to go specifically over autism spectrum disorder because it is a fascinating and interesting disability that many people misunderstand. And there's a lot of myths about autism. So we'll go into that in depth. We'll definitely touch on intellectual disability and orthopedic impairments like cerebral palsy or spina bifida or any other physical impairments. But first, we'll talk about the list of categories and then we'll move on to getting more in depth. So first we have autism spectrum disorder, which should affect more of the social and emotional skills of the individual. It may not affect their cognition, but we know that about 30 to 40% of people with autism are also going to have an intellectual disability. And we've talked about before that when you have a disability, you may have an accompanying disability, whether it's seizures, ADHD, dyslexia. It could be other health impaired things like gastrointestinal issues. But individuals with autism may or may not have intellectual disability and may or may not have a physical disability. But most likely, um, autism spectrum disorder you're not going to be able to see this in somebody. So, for example, if someone has Down syndrome, they have the facial characteristics of Down syndrome. Um, Autism spectrum disorder, there are no personal facial recognitions or anything like that where you'd be like, oh, okay, this individual has autism. So anyone could have autism spectrum disorder on any spectrum of autism. So you could have such a mild case that it's not diagnosed. You could have a mild case that is diagnosed. You could have a moderate case, or you could have a severe case that goes diagnosed probably very early in life. We have deaf, blindness, okay, not being able to hear or see. We have deafness. We have developmental delay. We have emotional disturbances, hearing impairments, intellectual disability, which we'll talk about a lot, multiple disabilities. So having, like we talked about, maybe all three domains are affected. Maybe you have cerebral palsy, a cognitive disability, and you have autism spectrum disorder. So many times people don't understand that there are multiple disability scenarios, and that can happen. Orthopedic impairments. So this may not impair their social skills or their cognition. It may just be a limitation in movement. And many people have orthopedic impairments. I've had orthopedic impairments in the past, where if you break your leg and you have to, you move a little bit differently, you have to use crutches, that type of thing. Other health impairments, specific learning disabilities, dyslexia, that type of thing, ADHD, speech language impairment, so needing a speech pathologist to help you, or a paraeducator to help you translate things, or learning how to talk. Maybe there's a tongue or a palate issue that happened at birth, like being born without a palate. Traumatic brain injury. This can happen as a result from if the mother was drinking, or if the individual had fallen, or if the individual went to war and came back, they had traumatic brain injury. And then we also have visual impairments, including blindness. So visual disabilities, you're not able to see, or you're going to want to adapt activities for that individual very differently, right? Because they're not going to be able to see anything. So there are camps like Dr. Lieberman's camp that focuses on people that have visual impairments, and there's a lot of Justin Heigl as well focuses on visual impairments. There's a lot of groups that focus specifically on visual impairments, and so they have their own kind of program and curriculum specific to visual impairments that are different than something for like autism or for intellectual disability. So just understand that there may be a different curriculum for all these disabilities, but and when it comes to physical education, we're all still just teaching the same things. Still teaching fundamental motor movement skills and fitness. We're teaching locomotor and object control skills. And we'll talk about that more when we talk about lesson planning. So PE and autism. So autism spectrum disorder, and I've talked about this in the past, is a social emotional communication deficit. So 1 out of every 45 children, the CDC says, has autism spectrum disorder. And fastest growing developmental disability in the United States, so it's the fastest growing. Boys are 5 times more likely to be diagnosed with autism than girls. And there's no medication, detection, or cure. And they're going to have difficulty in sensory processing, social interaction, verbal and nonverbal communication, and repetitive behaviors. So when it comes to people with disabilities, we have to be aware, and then we also have to accept these individuals. So we have to understand their disability, and then we'll be able to process how we will teach them in our physical education classes. So a sensory processing disorder can also be accompanied with autism spectrum disorder, which is a neurological process of organizing sensations for use in everyday life, done without conscious effort, automatic adaptive responding, like climbing stairs, flex and extend legs, alternate feet, that type of thing. The five main senses: vision, hearing, smell, taste, and touch. So maybe there's some visual deficits where they have to wear glasses, or it's overstimulating, or something smells. Taste and touch, these all can be disrupted by autism spectrum disorder. The tactile sense, providing sense of information through the surface of skin about the texture, shape, and size of objects within the environment. So some people with autism will like to be hugged and squeezed, and they like different textures. So tactile senses may have some differences. The vestibular sense, so the way we coordinate our balance inside of our inner ear canal, the vestibular system. So this gives us information about gravity, space, time, and balance, head body position. So like if you're on a roller coaster going forward, or if you're spinning around, this vestibular system is what is kind of regulating all that. And so you may have a deficit in the vestibular sense, which may interrupt their balance. Okay. The proprioceptive sense, so providing information through muscle and joints about where the bodies are, where they're moving and stretching, and what they're doing. So this might be interrupted. Most students on autism have sensory processing disorder. So remember, autism spectrum disorder, it's a complicated disability. It's not something that you can see. It's not something that you can understand until you are working alongside people with autism spectrum disorder. And you have to do it for years, not just work with one individual. Because once you've met one individual, you've only met one person with autism. So the converse is not true. Most students with SPD do not have autism. So most people that, if you don't have sensory processing disorder, then you're most likely not going to have autism spectrum disorder. So when it comes to communication, you want to put yourself in their shoes. So what would it be like to have balance issues, sensory issues, plus you're nonverbal and you don't understand language that well? Okay, so how would you try to communicate with them? You want to be expressive versus receptive. You want to think about motivating them instead of waiting for them to be motivated. So you want to be the one that is more assertive. Just because they can't express things verbally does not mean they do not understand. Okay. They need some extra processing time, so allow students to process information. Every time instruction and cues are repeated, students have to reprocess. So the limited information, the better. If you're saying the same things repeatedly over and over, they're going to have to think about these things over and over. So the easier you can express your communication, the easier it is for them to understand and process. Because remember, they have sensory disorder. So if they're not able to process these things that well, then you're going to kind of overload them. Body language, sometimes you have to pay attention to their body language and your body language, because sometimes they don't understand what you mean by your body language. Here's a kind of like illustration of what communication in autism looks like. So you can give them interpret facial expressions like, I'm mad at you, or I'm very sad, but they might not understand them. You might do some hand gestures like come here, or cut it out, or everyone stop. Like you would think that they would understand. They might not understand that. They might not be able to maintain eye contact with you. They might not be able to interpret your body language, and they might feel uncomfortable when you look at them. So if you're staring at them, they might feel uncomfortable from that. They might not know what to say. They might not understand what you're saying. They might not know how to appreciate your sarcasm, or if you're telling them a joke, they might not understand that. They might not know what the appropriate response is to your facial expressions, to your hand gestures. So they might not do anything. So you just have to understand that communication is going to be perhaps limited, and you're going to have to do your best to learn how to communicate with them. So you want to have a verbal behavior approach. Language can get them what they want. Always reinforce language, because a lot of times if they don't have to speak, they won't. And then eventually they won't have any social interaction skills in their life. So you have to promote language. Tell students what to do. So kick ball, not don't pick up that ball and throw it again. Let's just say they're not doing what they're supposed to. Just tell them what to do. Avoid the negatives. Try to stay away from no or stop it. Encourage things like try again or I'll help you this time. Be specific, not abstract. So awesome job waiting for your turn, Jason. Saying their name, telling them what they're doing right, as opposed to just saying good job. Or I really like the way you're sitting quietly, so they understand what they're doing and why it's being appreciated. We want to have a routine and structure. So first establish a routine. So first we warm up on the mats, then we warm up on the court, then we play our game in the middle, and then that's the routine each day. And so maybe it's something like that, or 4 or 5 part. Um, so you want to be able to meet the students in a certain area. You want to identify a schedule for the day. You want to have a consistent warm up that they're familiar with, so you don't have to change the skills every single warm up. The warm up should be pretty strict. Maybe change it every 5 weeks, but not every week, so they can get familiar with the warm up routine. Make sure the activities are kind of the same each time. So, for example, when we get into lesson planning, I'll talk about how I structure our lesson plans that help with that. And then always have like a cool down or cleanup. Have them help with cleaning up and make them feel like they're part of the established class. Having routines within the routines. So if you're having a warm up, let's just say you go run, stretch, push ups, and sit ups. Let's just say you go in that order every single time. This will help them remember the routine. Be organized and prepared. So keep students engaged. Be enthusiastic. Avoid boredom at all costs. And if you're bored, your students are bored. Okay. When it comes to routine and structure, you can just have just a nice little chart that says one, walk on green, and have a square box. Let's just say they're starting the class by walking on the green line, and then after they've done that, they check it off, and then you're going to warm up with a partner. After they've done that, they're going to check it off. Then they're going to sit on the bleachers, and then they're going to check it off, and then activity with partner, check it off, and then line up with class, check it off. And then I'm working for on the bottom of this chart so that whatever they're working for is at the bottom, and they state a goal or they state a treat or something that they can get something, like maybe it's an iPad, maybe you're working for a free play or something like that. So have a goal in mind at the end, so be like, all right, let's check all these boxes off because we're going to get what you're working for at the end of this schedule. We want to increase the predictability. So following the schedule, consistent instructions, defined expectations. So the same expectations, the same instructions. Try to be as predictable as possible. This will decrease the anxiety. Um, Other ways you can decrease anxiety are telling them how long you're going to do things for. So, okay, 30 seconds and then clean up. So they know that they have 30 seconds to play their game and then we're going to clean up. Or we'll say 5 more throws and then we're going to rotate. So instead of abrupting and ending something right away, you're saying, all right, we're going to do 5 more and then we're going to go to the next station. Okay, Andrew's turn, then yours. Okay, we want to make sure that they understand that they're going to have to work together, that they're going to have to take turns, they're going to have to share things, and that these are all expectations. Previewing, so preview, so tell them what they're going to be doing, how they're going to be doing it, and then give them any visuals, tangible items, or vocabulary words that best work for them, because they might work best with certain vocabulary words. They might need tangible items that they're working for, and you also want to show them a visual of what they're going to be doing. Okay, whether that's tiny pictures, smiley faces, or your own type of schedule, it's up to you. When it comes to external stimulation, we want to eliminate it as much as possible. If we have to move to the hallway, if we have to use dividers or math, if we have to limit the amount of equipment being used, that might help because sometimes we need them in their own personal space. and then small group space, and then general PE. So it's like we're trying to slowly get them to general PE, but sometimes they're not going to be able to learn anything if they can't concentrate. So they might have to be, we might have to eliminate external stimulation. Self stimulation, so we want to eliminate that as much as possible. So when they're doing self stimulating behaviors, which we want to try to get them on task. So vigorous exercise can help with this. Being engaged with them can help with this. When you have a good plan and you're prepared for class, you're going to lower their self-stimulation behaviors. And self-stimulation behaviors could be something like clapping, could be something like talking about the same things over and over. It could be a restrictive behavior that, you know, gets them to avoid working with other people. So if you have good planning, you're engaged, and you're performing vigorous exercise, and there's not enough time to think about these variables, then we're going to lower the self-stimulation. I want to allow the students to work for their desired reinforcer at the end of the lesson. So tell them that they're working for something. Know what each individual is working for, so you can say to them, "Hey, let's get this done. If you get this done, we're gonna get whatever you want at the end of the lesson, whatever their enforcers are." So have visuals if possible. Provide a visual. May not understand spoken word, but may be able to associate a visual with an activity. So that's why visuals are the most important, because they might not be able to process language, but they may be able to process visuals better than language. And sometimes that involves technology and iPads, or it just involves pictures of what you're going to be doing. So what's better? Introducing basketball. Sorry about that. But when it comes to how we can get them most prepared for exercise or a new activity, we do what is called social stories. So social stories are when we describe a situation, skill, or concept in terms of relevant social cues in a patient and reassuring manner that is easily understood by its audience. So it addresses issues that impact students' participation in PE. It's a tool to assist individuals on the spectrum to better understand, and it can be presented in a written illustrated form. So basically, we can have a social story that talks about going to PE and basically giving them a rundown on all the different steps of PE, and then making pictures for all the different steps. And then I have some examples here, but we'll kind of move past that. So when it comes to playing in PE, a social story about good sportsmanship would be: playing games with other kids in PE can be fun, but I won't always win. So you're kind of setting them up for, hey, it can be competitive and we're not always going to win, or expect that you might lose, and that's okay. So you might even say, sometimes I will win, but sometimes I will lose, and that's okay. So sometimes someone might be faster than me, or someone might get something quicker than me, and that's okay. I will tell others good game, or give them a high five and say nice job. I will smile and have a good time. It's okay to not win all the time. So kind of giving them a social story about good sportsmanship. And then you can have, maybe you do good sportsmanship one day, maybe you do a social story about just, maybe it's motivation. So you just depends on the individuals. When it comes to reinforcement, you got to be positive. It's got to be specific. It's got to be frequent, and it's got to be consistent. Verbal praise is really important. When it comes to telling them that they're doing a good job, telling them that they're doing the right thing. We've talked about saying, what they're doing right. So having physical high fives, hugs, pats on the backs, and pressure. This depends on the student. And then you can also have reinforcements like token boards, which are kind of token economy, where they earn points or tokens for doing the right thing. And this is one of the best ways to change behavior, which we'll talk about in our last lecture. When it comes to forced choices, instead of saying things like, do you want to play soccer? The student can just say yes or no, right? Instead of saying that, you might want to say, do you want to play soccer for 5 or 10 minutes? Okay, okay, 5 minutes. Okay, just 5 minutes? Okay, we'll just do 5 minutes. Are you going to kick the purple soccer ball or the red soccer ball? Okay, instead of saying, do you want to kick the ball, you can say, what ball do you want to kick? And they might say, oh, the red ball. So giving them choices, but telling them what they're going to be doing, as opposed to ending it with a yes or no. We're using the PREMAC principle, okay? So we're doing this for all of our students, specifically with individuals who need it the most. And so if they don't need it, it's fine, but many will do this, many will need this, such as following an undesirable activity with a desirable activity. So um, first PE, and then we'll get our computer time. First, we're gonna shoot 5 times, and then we're gonna run. First, we're gonna stretch, then we get to play with the scooter. Okay, we're gonna have our veggies first, and then we're gonna have ice cream. So the PREMAC principle basically is a behavior principle that allows us to tell them what they're gonna do after they're doing what maybe they don't wanna do. But in order to get them to do physical fitness, we might have to give them a reward after. So general tips for autism: be enthusiastic, have a plan, know your students, accept mini victories like lining up correctly or waiting for turn or eye contact and smiles. These little things are mini victories because we know that some of them might not give you eye contact. Some of them might not know how to wait for turn or line up correctly. So, and any smiles are great. So ask questions to the classroom teachers, paraeducators, and the student. Never underestimate them. Use visuals, be predictable, have smooth transitions, use stations, allow for extra time, eliminate excessive stimulation, vigorous exercise. This is going to reduce those repetitive behaviors, so getting them moving. If the more moving, the better. And then have duplicate classroom teaching strategies. So apply behavior analysis, verbal behavior approach, token systems, reinforcers. So these are all things that they do already in special education. And now you want to also make sure that you're doing those in your class. Okay, so that kind of translate over. Now we're going to go ahead and go back to our PowerPoint and get into all the different types of disabilities here. Okay, and what really disability is, and we'll talk about impairments, and we'll then talk about some suggestions and pointers for different disabilities. So disabilities occur in various forms affecting how the body and mind work. An impairment is an absence of or an extreme difference in a person's physical structure or mental function. When it comes to activity limitations and participation for restriction, it refers to executing a task or action, whereas participation restriction deals with a person's involvement in a life situation. Different disabilities we'll start talking about. We'll start with A, so arthrogryposis. This is a condition where the joints are stiff and there's limited range of motion. And so this would be maybe classified as an, you might see this as an orthopedic impairment or a physical impairment. So think about adaptations that may need for children would depend on where their joint contractures are, but could include having the materials handed to them or placed in a higher area if bending down is difficult, or bending or helping them walk, move during transitions or activities. So they tend to have average cognition, so no adaptations and instruction delivery would likely need to be made, but physical alterations to the environment may be necessary. So we talked about how some disabilities might not affect cognition or social interaction, which may just have to affect their physical condition. So this affects the joints, creating joint contractures, which results in extreme stiffness in joints and limits the range of motion one would normally have. Okay, so kids are affected by this. I chose this. So physical activity for individuals with this condition will give a lot of focus on joint range of motion and flexibility. So working in the water to alleviate pressure or pain of the individual joints might be good for these individuals. Focusing on flexibility, range of motion. It would also be beneficial to have wheelchairs available to help students participate in exercise activities, and making sure that they're able to, if they need to pace themselves or sit down, that they have that available. Asthma. So asthma is a condition in which an individual airways become inflamed, narrow, and swell and produce extreme mucus, making breathing difficult. So making sure that you know who your students are that have asthma, because you're going to want to make sure they have their inhaler, right? So making sure there's a safety precaution plan for them. Strict to less strenuous exercises and activities for this individual. especially with the warm up. Make sure it's nice and paced. Make sure you have a warm up. Make sure you have a cool down. And then limit high intensity endurance, such as sprinting, because it's going to kind of exacerbate asthma. So, when it comes to autism spectrum disorder, we've talked about that. It is a developmental disability that can cause significant social communication and behavior challenges. It refers to a broad range of conditions characterized by challenges with social skills, repetitive behaviors, speech, and nonverbal communication. Autism presents challenges in social communication and behavioral settings. Most of the time, there's no cosmetic difference with people who have autism. We've talked about how there's no real facial features that you can see. They can learn, interact, adapt, and behave differently. So just because you met one person with autism doesn't mean they're going to be like another person, but there are going to be some buckets, I guess you could say, or different changes that some have, right? Someone with autism can be very gifted or severely challenged. So you might have someone who's on the mild end of the spectrum or who has Asperger's. And this is a name formally given to students that had a higher intellect and that were able to remember things that no one else could, and could had some gifts that many other people didn't have. So you can have mild to severe intellectual disability with autism. You may have no intellectual disability, and you may even have higher cognition. Okay. Some physical activity adaptations should be focused on presenting of activities. This means using modeling, using photos to illustrate what the instructor expects, and a schedule would be most important when we talked about that, so they know what to do. They may respond better with visuals and technology than actually verbal cues. Some individuals with autism need sensory supports because they have heightened response to sensory input. So stress balls, mini trampolines will allow them to stay calm during physical activities for some of them. Giving them an outlet to move, like a trampoline, or somewhere to do some low intensity movement so they don't overwhelm themselves either. So activity adaptations for individuals with autism: use visual cues, step-by-step instructions, checklists, body exercises. Change activities frequently, but focus on the skill. Children with autism find change and uncertainty stressful, so visual cues are necessary. When it comes to changes in activities frequently, make sure that you are not boring them with the same activity through 30 minutes, because no one's going to do the same activity for 30 minutes. You have to slowly progress the skills throughout the activity so that you're learning something new and interesting as opposed to something the entire time. You'll lose their attention and focus. Varying the task techniques help them let the brain know that the certain skill is crucial. So letting them, when we vary the skill, that's going to be really important for them. Physical activity that the person is expected to participate must be explained to them in a way that they can understand. Let's go ahead and move to cerebral palsy, since we've talked about autism a little bit in depth. So cerebral palsy is a group of disorders that affect a person's ability to move, maintain balance, and maintain posture. Cerebral palsy characterizes a group of disorders that affect an individual's ability to move and maintain posture and balance. People with CP have mild to severe symptoms, ranging from individual walking awkwardly to an individual unable to walk at all and needing lifelong care. I shouldn't say awkwardly, I should say with an impairment. Um, Most have problems with posture and movement. Many can also have intellectual disabilities, problems with hearing or vision, or joint problems. So, like we talked about, you're going to have an accompanying disability. When you have a disability, and a lot of times with cerebral palsy, it might be with vision, or it could be with joint issues or problems. It could be hearing, and also intellectual disability. So having multiple is pretty common. There are three different types of CP: stiff muscles, uncontrollable movements, and poor balance and coordination. And then many have increased muscle tone. So sometimes you'll see someone with their elbow bent all the way, and then you go to kind of relax their elbow or straighten out their arm, and there's a lot of resistance. So you have to slowly extend their elbow, slowly extend their fingers, try to work on range of motion. So I would always try to get them out of those bent elbows, bent knees, or bent fingertips, and I'd really try to stretch those fingers out, and really focus on range of motion and warming them up. This will lead to less stiffness of the joints. So we want to think about ways to help them because they're going to have really stiff joints as it is. So let's help kind of take the pain away a little bit, and then also working on mobility, getting them in the pool, cardiovascular fitness. So getting them maybe on a tricycle is a good idea. Um, we want to have alternate exercises ready for individuals that utilize wheelchairs. So things like battle rope, exercise balls. You can even jump. You can even move a jump rope around, and you can do lots of different things in the wheelchair, which we'll talk about in future lessons. Cornelia de Lange syndrome. So it's a genetic condition present at birth. This is going to be a smaller size head and development of intellectual disability. This is going to be, you're not going to see this in most cases or most scenarios, a pretty rare disability, but this individual's going to have facial characteristics are going to be pretty distinct, smaller head, and then they may have similar symptoms or similar um, characteristics of autism, hearing loss, visual issues as well. So there might be an array of disabilities that also affect this. So you may have to have extra time between in between directions for allow processing of information. So they're going to may have some sensory processing disorders as well. Make sure they have a buddy to help them and help them advocate if they need something. So try to have a paraeducator or buddy along with them. They can also have a tough time speaking for themselves. So you're going to have to maybe help them translate or give them some ways to express themselves. Um, we'll have to make sure that exercise is easily understandable. They may have hearing loss, so you might have to have good visual cues, and then you may have to demonstrate with proper form, because they might not be able to exactly perform everything. Some of them will have congenital heart defects, so controlled aerobic exercise, and how you train for that, and then focusing on joint movements daily are beneficial for these individuals. Cystic fibrosis. So this is a genetic condition occurring progressive. It's a progressive disease that causes lung infections, limits person's ability to breathe over time. It's important to incorporate short recovery breaks throughout an exercise routine to ensure students with CF can catch their breath and hydrate. Um, Cystic fibrosis mainly affects the lungs. It's common with people for this condition experience shortness of breath during physical exercise. Just take that into note. Fragile X syndrome. It's a rare genetic disorder that has a major effect on a person's life and is most common most common case of an inherited intellectual disability. So activity adaptations, charts with lists and schedules, preparation for seizures. They tend to have more seizures than other people with disabilities. And then they may have deficits in memory and learning new skills. So that's why you have to do sometimes the same thing over and over. Sometimes they're not going to be able to remember what they did last time. And so if you're just changing it up every time, you're really not going to give them a chance. So that's why you want to try to make things routine and easy to remember. Hearing loss. So hearing loss when any part of the ear is not working in the usual way. Includes the outer ear, middle ear, inner ear, hearing nerve, and auditory system. So a hearing loss above 90 decibels is generally considered deafness, which means that a hearing loss below 90 decibels is classified as a hearing impairment. Okay. Activity adaptations provide a written description of schedule and activities, provide augmented communication if not already used. So some of them will have keyboards, some of them will know how to sign language, provide ways to communicate both receptively and expressively, provide written schedules and descriptions. Knowing some basic sign language will help both the learner and the teacher be able to communicate. So especially when exercising, knowing how to say stop, go, that type of thing. Maybe learning sign language of the curriculum of the sport before you teach it. The adaptations made for people with hearing disabilities would vary based on the severity of the hearing impairment and how the individuals communicate. The people communicate and physically active understand sign language, and sign language would be a great way to give instructions. Okay. When it comes to visual cues like cones, flags, or images, saying go or stop should be used instead of sounds like whistles or verbal commands. And if rules are clearly understood, then group participation can more easily happen. Down syndrome. So, Down syndrome is a congenital disorder arising from a chromosome deficit causing intellectual impairment and physical abnormalities, including short stature and a broad facial profile. Typically, individuals with Down syndrome are associated with physical growth delays, mild to moderate intellectual disability, and characteristic facial features. Some physical characteristics of people with Down syndrome would be hypotonia, which is low muscle tone, or ligaments laxity, which is looseness of the ligaments that cause increased flexibility in the joints and decreased strength. Okay, so activity adaptation. So we probably want to limit the flexibility training and focus more on mobility and strength training, in my general opinion. And the adaptations that might need to be made for the disability could include making sure that exercise requires is a lot of focus because they're going to have some heart issues and they do tend to have higher incidence of obesity. According to CDC, some individuals with DS have deficits in movement, such as timing, balance, coordination, and muscle tone and strength. So lower muscle tone, we're not going to see many people with Down syndrome with high muscle tone, although there are breaking the barriers. There are bodybuilders now that have Down syndrome. Breaking down the skill into small components will allow the individual to focus on one body movement at a time. Notice any difficulties the individual may have. Teaching body awareness and balance and spatial awareness will all allow the individual to become aware of his or her strengths and limitations, as well as how to control his or her movements in space where there are other people. Because sometimes they might not have good spatial recognition. They might, bump into people. So you want to make sure that you have boundaries and that they understand where they are and help them move in the controlled space. Duchenne muscular dystrophy is a collection of diseases that over time cause decreased muscle functioning. So this is going to limit their range of motion over time. So we want to think about increasing the range of motion, doing range of motion exercises, joint flexibility. They may utilize wheelchairs, may have aids and braces. One of the things individuals can do is stand for a few hours a day. So we want to get them up as much as we can. Standing enhances circulation, aids in bone health. So the more we can get them up, the better. The more they're seated, the more detriment it'll be for their body. Parkinson's, so it's a disorder in the central nervous system that can affect movement and cause tremors. Someone who may have Parkinson's disease are challenged with movement, stiffness, and loss of balance. It may affect the central nervous system and impair movement. And it's typically for older populations, but it's noted because it is an adapted physical activity, and that we have to increase their balance and we have to supervise them to avoid injuries because they're more susceptible to falling, and we don't want them to fall, break a hip, or get a concussion, that type of thing. So Parkinson's has to be highly monitored. Peripheral neuropathy, so this is defined as weakness, numbness, and pain, usually in the hands and feet, caused by damage to the peripheral nerves. This nerve damage can be caused by multiple factors, including traumatic injuries, infections, and diabetes. May be present in one or more symptoms listed above, and adaptations should be symptom specific, such as weakness and numbness may cause issues with balance, whereas pain may cause difficulty standing for an extended period of time. An example of a visually assisted movement adaptation for individuals with numbness is having a mirror angle to where they can see their feet without having to look down. Having easy access to chairs and adaptation should allow these individuals to rest when needed, or if they're ever having loss of pain or loss of balance or numbness. Sound aided awareness helps individuals suffering from numbness. Tap shoes can allow an individual to know when their feet have touched the floor. So this numbness, they're not going to be able to know where their feet are. So tap shoes, things that make sound, are going to help in the physical activity setting. Prader-Willi syndrome is a genetic disorder that can cause a person to suffer from hypotonia. So this is low muscle tone, delayed developmental delayed development, behavioral problems, and usually have an intellectual impairment. So behavioral problems, maybe that's being aggressive. It could be being very emotional and dramatic to the point where they might run out of the building and you have to go get them. Um, Activity adaptation, so might need to be made, could be include make sure the exercise requires a lot of focus, give them moves that require all their focus, and use visuals and guides. Once they lose their focus, they may start having behavioral problems. Okay, with delayed movement and intellectual impairment, it's not a good combination. So you want to make sure that you have a good plan. Rett syndrome. Rett syndrome is a genetic condition affecting girls, okay, as they develop. It includes rapid loss of coordination, speech, and hand use. So over time, the disability gets worse. It's a genetic neurological disorder that leads to severe impairments affecting speaking, walking, eating, and sometimes breathing. So you can go from basically a normal baby where you think everything is fine, and then as their life continues, it gets things get worse and worse over time. So, adaptations for these individuals, we want to maybe have Velcro straps like on their racket. They're going to start losing strength. So you might have to have that like Velcro straps for them when they're holding things. They might have lack of head control. Um, so over time, they just start losing the ability to move and control their body movements and their body coordination. So fine motor skills can be underdeveloped, so use big equipment so it's easy to hold and work with. Light, big exercise or light, beach volleyballs would be a good thing. Scarves, things that are very light that they can manipulate. So kicking a big ball that's very light, not a hard ball that would hurt their foot. Okay, they might utilize a wheelchair most likely, or use crutches. And so you may have to do some hand over hand. Running or jumping is probably going to be very difficult. So things that are stationary or that include walking might be a better idea. Spinal cord injuries. Okay, it's defined as damage to any part of the spinal cord. This often results permanent loss of sensation, muscular strength, and other bodily functions below the injury site. So spinal cord injuries are classified as either complete or incomplete. A complete spinal cord injury results in loss of sensory abilities and motor functions below the injury, and there are varying degrees of incomplete spinal cord injuries where only some motor or sensory functions are lost. Additionally, some cases only one side of the body may be affected. Adaptations for physically activity must be specific to the ability of the individual. So, not a one size fits all approach, especially with spinal cord injuries. Head exercise for paralysis from the neck down, chair exercise for paralysis from the waist down, exercise using the unaffected side of the body, water or other non weight bearing exercises, getting in the pool. Floor exercises could be utilized as well. Sickle cell anemia. So this pertains to individuals who have inherited two sickle cell genes, one from each parent. Okay, this genetic condition causes irregularly shaped red blood cells. Okay, and individuals with this disease are recommended to maintain a mild body temperature and to not exhaust and overheat themselves in extreme climates. So swimming is a good activity that they participate in that's very safe and controlled as far as temperature goes. It's not a high impact sport, so uh, then they can take breaths as they need or breaks as they need. Spina bifida is a condition that affects the spine and is usually apparent at birth. So this isn't a spinal cord injury. This is a spinal cord deficit or impairment that happens at birth. Okay, it's a neural tube defect. It can happen anywhere in the spine. If the neural tube does not close all the way, this happens at birth and is described by is a neural tube defect which occurs when the baby's neural tube does not develop or close as it normally would. Okay, there's three different types, and what we want to make sure is that individuals may have utilized a wheelchair, they may have a shunt. Okay, the adaptations as far as what to do with them is you want to make it low impact if possible. You want to have movement selection depends on where the location is on the spine. If they are looking for higher intensity exercises, something like battle rope, cable machines, things that are mainly things that you can do with an upper body. So that's why I like cable machines. That's why I like battle ropes for these individuals. If it's higher on the spine, the person may be paralyzed and use wheelchairs. If it's lower, they might have more mobility in their legs. So it just depends. Um, because spina bifida results in a wide range of disability severity, adaptations to an exercise will be individually based, as they will for most physical disabilities, in my opinion. Tourette syndrome affects the nervous system. It has what we call tics. These are vocal tics. Um, they may be profane and they don't affect the whole body, but it may interrupt the class. And so you just have to understand that this can happen and that adaptations made for this disability include making sure that the exercises require a lot of focus because that can take their mind off the tics, and that so the more vigorous it is, the less time they'll have these tics. Traumatic brain injury. It's an injury to the brain by a blow to the head or pertaining a head injury that disrupts normal function. I would say that activity adaptations for this population would be to have lower, I would say lower cognitive based activities, so simple instructions. Um, it depends on where they're at. Obviously, the injury is going to be different for everyone. So you want to make sure that if they're on any type of prescriptions, that you know about those prescriptions before you take place in activity, and then also just know them individually. Visual impairments. So a disability which has a broad definition spanning from people who cannot see to a person who has partial vision loss. Okay, vision loss is when a person's eyesight is not corrected to a normal level. Vision loss means that a person's eyesight is not corrected and it can vary among people. So use balls that have beeps, do things like freeze dance, team activities. Spaces should be set up in a similar fashion so that every student can move around their own environment. So you may have to use hand over hand. You may have to use assistance. They may have to hold on to someone's hand while they're doing activities, or maybe a string while they're running somewhere that's hooked on a line so they can run from one base to another while they're holding onto a string. People can clap, use bells at bases or beeps, so making lots of sounds, but also not cluttering sound because then they might not be able to understand where the ball is coming from, that type of thing. Okay, so that is a little background about disability and the different types. Now we're going to talk specifically about intellectual disabilities and some general pointers and modifications. So, intellectual disability means significantly sub-average general intellectual functioning that adversely affects a child's educational performance, existing concurrently with deficits in adaptive behavior and manifest during the development period. General pointers for people with intellectual disabilities, basically they may have poor muscle tone, um, includes people with Down syndrome, so they may experience upper respiratory infections or heart deficits. They may have communication delays. They may demonstrate short attention spans, may experience delay in reaching milestones in growth and development. Students may have difficulty comprehending and following directions, especially in multi-step directions. May experience delay in social skills, lack confidence, or lack motivation. May have a low level of physical fitness. Um, they may have medical medications that they're on or medical precautions. So make sure that they fill out a one of those health forms before they participate. Make sure that they've been screened for antioaxial instability of the neck, because a lot of times they may have a loose neck, so that can result in neck injury. So you want to be careful not to do anything on their neck like gymnastics if they have that. Provide a variety of modifications as needed. Some modifications and suggestions for people with intellectual disabilities: provide highly structured environment. Use a variety of cues, including pictures, symbols, Use brightly colored objects, establish boundaries using polyspots, cones, rope. Keep instructions brief and simplified. Break tasks into small, attainable steps. Pair instructions with repetition as needed. Offer a prompt, positive feedback, and be consistent with motivators. Avoid food as a motivator. Keep rules of a game to a minimum. Avoid abstract language. Use concrete materials to emphasize lessons. Be firm. Maintain class structure. Be flexible. Have patience, patience, and patience. Use stations to teach skills and activities. And set up self-paced activities and opportunities. So those would be some pointers and suggestions for people with intellectual disabilities. We've talked about autism before, but we'll talk a little bit about it, and then we'll get into orthopedic impairments, and then we will move on. All right, let's see. So when it comes to autism spectrum disorder, general pointers, they may be nonverbal. They may display a lack of eye contact. There may be restricted range of interests. They may be resistant to change in routine or schedule. They may display obsessive repetitive body movements such as hand flapping or spinning. They may have lack awareness of existence of feelings of others. They may lack fear or real danger or real fear for no apparent reason. The student may have an unusual response to stimuli or sensation like pain, touch, noise, hearing, taste, smell, and balance. There may be a wide range of behavior from repetitive to aggressive to extremely passive, and may develop an attachment to unusual objects like toys or a piece of string. So those are just some pointers for people with autism. As far as modifications go, we want to establish the predictable and structured routines. We want to establish consistent classroom expectations and consequences. We want reinforcements to be positive, consistent, and frequent. We want to integrate social skills, opportunity to practice self-control and social problem solving activities. We want to use visuals, picture stories, station signs, picture symbols, and etc. We want to choose activity-based learning, encourage vigorous exercise to reduce self-stimulation, allow the student to become familiar with established routines. We want to use stations to teach activities, keep same stations for several weeks, and change only one station at a time to maintain routine. We want to eliminate excessive and extraneous stimulation. We want to duplicate teaching strategies from the classroom teacher and use their same vocabulary, rule set, and reinforcements. We want to avoid abstract lessons and language, be deliberate and concrete, limit the sarcasm. They're not going to understand it. No one understands it. I don't understand it. Provide a cool down or break space in the gym where the student can go to settle or get himself or herself under control, and give prompts and cues so that the student is aware when the activity is changing. Let's talk about orthopedic impairments. Sorry, I don't have that one. Let's talk about visual impairments to end. So visual impairments, we want to have a wide variety of, when it comes to visual impairments, there's going to be a wide variety. Student may or may not use a cane. Physical fitness is typically going to be below a sighted peer. They're going to have lower balance. They have fundamental movement patterns and skills that will be delayed. They may demonstrate poor posture. They may have low frustration level. They may fear to try new things. Speaking louder isn't going to enhance the lesson. However, do introduce yourself or excuse yourself every time you come in or leave the room. Be organized, use auditory signals, and emphasize what the student can do. Mannerisms such as rocking, waving hands, ducking head, twisting the body can be minimized by providing activities. Provide an orientation of a new space, such as a gym or field, as well as equipment. Know the student's name and medical diagnosis, including possible restrictions. Use other sensory modalities to provide information. Okay, so auditory presentation, tactile exploration, assistance by moving their body through the motion. Ask permission, explain what you are doing before touching the student. Auditory presentation needs to be short but descriptive. Information can be presented in Braille. An example would be 5 feet in forward instead of over there. Describe the activity before the student tries, and be descriptive but concise. Use partners for social development and assistance during games. So sighted guide, special equipment like audible goal locators, beepers, radios, audible goal balls, bells, guide wires, rope tape to the floor, talking pedometers, etc. Space is clear of obstacles. Boundaries are defined. Rope, incline, decline, different floor texture. Doors are fully closed or open. Proximity to the teacher, so look at the teacher. This sounds out of place. However, it is normal speech. Personal space is marked polyspot so they can feel things. Bright colored, larger equipment. Orange and yellow work well, but ask the student. Use contrast between figures and background, softer or lighter materials to minimize fear. Spend extra time on body awareness and spatial awareness, balance and gross motor skills. Play games in slower motion. In running games, use one direction to travel. Limit the size of the playing field. Require plastic guards for glasses when students participate in vigorous activities. Please, no background music. It makes it hard for students to hear what they need to hear. And ask the students what they need to participate, what they can see, how the activity can be modified. Okay, so that would be kind of how we would um, formulate our lesson plans for people with visual impairments. Now, what about orthopedic impairments? General pointers, they may be ambulatory or non-ambulatory. They may be able to walk or not walk. May have upper or lower body part range of motion that could be limited. They may have a communication delay. They may have difficulty generalizing skills from one situation to another. They may demonstrate seizures, sensory loss, scoliosis. They may have balance or coordination issues. They may have prosthesis, prosthetic legs, may have low level of fitness. They may have medical precautions, and make sure that the gymnasium is accessible. They can get in and out. Whether it's with a ramp, the doors are open, they don't have to get someone to open them up for them, that type of thing. Make sure it's ADA accessible, basically. Modification suggestions, so provide a variety of activities for differentiation, so different skills, different progressions of the skills, regressions of the skills. Use larger, lighter balls, use larger targets, modify the playing area, modify the rules, the games, and the activities, shorten game time to ease frustration. Use noodles or other implements to assist in expanding reach of the student, so when you're playing tag, give them an extra long noodle. Attach equipment to the chair or walker, so maybe you would attach these things to the chair so that they feel like they're part of the game. Maybe they're attaching a hockey stick to a chair so they can play with a big ball if they utilize a wheelchair. I've done that before. That's really fun. Use large scooters. And maybe that will help them get on the scooter. Large mat scooter. Put mats on top of the scooter so they can get on top of the mat. Or scooter seats for mobility so that they can do scooter games. Modify locomotor patterns. And I like them on their stomach on the scooters as well, if we can get them on their stomach. Utilize movements, activities with the student's range of motion. So bend and straighten, shake, um, you know, um, modify activities for non-disabled peers. So instead of a no hands rule, reverse it to hands only, or no feet to a level field playing for chair users. So instead of having regular volleyball, have seated volleyball or scooter basketball instead of standing basketball, so that they have people in the wheelchairs and scooters and everyone has the same advantages. Provide additional rest periods as needed. Stress cooperation and peer interaction is going to be important. Utilize sitting or kneeling in place of standing activities. So you could do like seated soccer, like crab soccer, that type of thing. Ask how he or she might participate in the activity. So maybe they have an idea of what they could do. Focus on reaching, grasping, and pushing. Pushing things, pulling things, grasping things, push pull exercises, and then provide lessons and activities in lifetime leisure games and skills. So that is going to be some pointers and suggestions. We talked a lot about almost every disability you can think of when it comes to what you're generally going to see. Most of the time, it's going to be intellectual disability, autism spectrum disorder, and orthopedic impairments, visual impairments, and hearing impairments. And there's going to be a minority of the other disabilities, but you just have to look the disability up. If you've never heard it before, do your research, get to know the students, and understand the disability and how to adapt and modify those games and activities for them. So what is next? Lecture number 4, actually, standards and learning outcomes, will be next. And I appreciate everyone today. I hope you have a great day, and thank you a lot. All right, take it easy.